Chief Medical Officer Dr. Roshan Parasram says data for acute viral illness show a similar trend to COVID-19, illustrating a sharp dip in March where public health measures were enforced, increasing in August, and again dropping when mandatory mask wearing was enforced. Dr. Parasram adds that influenza was also well under control this year.
And influenza is a little different from what we were seeing with the acute viral illness. A small portion in the early part of the year where we would not have had public health controls, and then all the way through, we saw a flat line basically going all the way down on the bottom.
The Chief Medical Officer was also pleased that cases of gastroenteritis have been extremely low for 2020.
So with our increased hand washing, our increased sanitary and hygiene measures, we saw gastroenteritis. This first slide is greater than 5 years. Stay after March, again staying well within the endemic channel for the period and staying extremely low for this year. We haven't seen any significant rises at all in gastroenteritis for this year.
The top medical officer also noted that this is the third successive year where there have been no deaths due to dengue. There have only been 79 suspected dengue cases for the year so far, compared to 232 in 2019. But he says this has been a continuing trend over the last 5 years.
We have seen over the last few years a significant drop in the number of dengue cases in Trinidad and Tobago. About 5 or 6 years ago, we would have seen numbers in excess of 5,000 cases every year. Those numbers have gone down to, the next slide I will actually show what happened, but basically for this year we see a very low level.
In 2014, the number of dengue cases stood at just over 5,000, but decreased significantly to 1,687 suspected cases in 2015 and has been on a continuous decrease since. Sonolala, TTT News.